Welcome back. Spectrum Health recently introduced a new technology for patients who may be facing lung cancer and other lung diseases. Join us this morning, Dr. Gustavo Combo-Nicelli, along with Dr. Jeffrey Lamb. Good morning to both of you.
Morning. Thank you for having us.
Thank you so much as well. Can you tell us a little bit more about what this technology is?
Right. Thank you for that question. Here at Spectrum Health, we really prioritize cancer care. And we know that roughly 150,000 Americans, they have these very small spots in their lungs that nobody knows what they are. And the anxiety comes when we don't know if they're cancer. So we develop ways to go about these very small spots in which we combine different available cutting edge technologies in order for patients to be able to come to Spectrum Health through Lemon Holton Cancer Pavilion. And we can do pretty serious detective work to find out what these little spots are.
And Dr. Combo-Nicelli, tell us a little bit more about specifically how this technology is going to work, kind of more in layman's terms for everyone.
Oh, absolutely. I want you to think about the lungs as being sort of a tree. There's a major air pipe called the trachea, and then it starts dividing into very small branches to leaves. A lung nodule is essentially one leaf that we don't know, what's going on. So this technology essentially was developed in order to reach to that very high end of the tree and be able to plug this out. And we do this combining robotic technology with a lot of precision, a lot of accuracy. We see all the way up there where that little pesky leaf is. And we use a CAT scanner to make sure that the needle or whatever instrument that we want to biopsy that nodule or that spot is, that it's inside of this spot. So what does it mean for patients? Well, it means that they have a very small spot that other available technologies may not be as good or as safe. And we combine three different technologies: robotics, a CAT scanner, and a special GPS to get all the way up there in the tree and pluck it out without breaking any branches.
And prior to this state-of-the-art technology, how did you go about doing these types of things? Or could you do many of the things that you're able to do now?
Absolutely. Between philanthropy and our community leaders and our executives and leadership at Spectrum Health, and a lot of passion for improving the health of the community of the West Michigan population, we decided to invest heavily, human resources, financially, and get all hands on deck. So essentially, we are innovators at Spectrum Health, and we're really pushing the limits. And we were the first one in Michigan and the fifth in the country to acquire this robotic platform. On top of that, Spectrum Health has CAT scanners, and we're able to combine this GPS, electromagnetic navigation. And now we're proud to say that our diagnostic yield, meaning how often can we tell patients what they have, is skyrocket high. Yeah. Our complications is extremely slow. It's an outpatient procedure. And really, there's no cuts, there's no bleeding. We hope that there's no problems, and the patient can come. In a few hours, they go home and they sleep in their beds.
That's remarkable. Outpatient procedure. That's fantastic. And you said you guys were the fifth in the nation to have this?
We were the fifth in the nation to get this technology, first in Michigan, and we were the first in the country and actually in the world to combine these three technologies. And the wind under our wings was our desire to hopefully learn enough about these technologies to be able to cure cancer. And Dr. Lamb, our expert thoracic surgeon, has been instrumental in making all of these dreams for us come true and be able to provide patients with world-class care. We're glad to be one of the players leading the pack in the country.
Well, we're glad to have this. This is wonderful. This means so much for the future of this type of disease. So how do patients find out more about this option?
Yeah, absolutely. We have Lemon Holton Cancer Pavilion is our flagship place to provide patients with the care that they need. So they call 1-855 SH cancer. That's 1-855 SH cancer. We, with Dr. Lamb and the rest of the team members, we are committed to allow patients to have expeditious, fast access to healthcare. And following our CEO, we made a commitment to provide personalized healthcare, made a simple, exceptional, and affordable for our beloved West Michigan population.
And is it my understanding that we have Dr. Lamb on with us as well?
Yes, I apologize for coming in later. I was
that's okay.
Taking care of some patient issues.
No problem. Real quick, what is your take on all this wonderful technology and what it means for what it is that you're able to provide patients?
Yeah, so I think the bottom line, thank you for having me here. The bottom line is we're really trying to provide patients with the safest sort of way to navigate through this cancer process and trying to minimize the amount of discomfort, get them in and out of the hospital as quickly as possible. And I think that's especially important right now in the midst of this COVID pandemic. I think patients are scared. Patients are scared to leave their homes and come to the hospital. And they're scared about undergoing biopsies and testing and potentially surgery. And so anything we can do to lessen that fear and apprehension, get them through this process safely, minimize incisions, minimize pain, I think that makes it sort of safer for everyone and better for everyone. As Dr. Kumar and I have discussed in the past, we really don't think that patients need to go 3 hours west to Chicago or 2 hours east to Ann Arbor or Detroit. I feel like we can provide world-class care here in West Michigan. And really, we're going through some cutting-edge technology here, providing patients with the latest and best.
World class indeed. Thank you so much for all that you do there. And once again, if you would like more information, call 855-SH-CANCER.